Okay, welcome everyone, and thank you for joining our workshop session titled Centering Our Work on Survivors and Community Needs and Leadership by Listening to the Needs of Black Women. We are so very excited to have the fine company of Timike Boyd-Jones. Timike, we got to hear from her a bit earlier in the panel, but just to remind you, Timike is a program specialist and preventionist at the Indiana Coalition Against Domestic Violence. She is also the Rape Prevention and Education Coordinator. Timike serves as the co-chair of the Indiana Disproportionality Committee. She's an active member of the Commission on Improving the Status of Children in Indiana's Equity, Inclusion, and Cultural Competence Committee. And she also serves on the Indiana Health Equity Action Team. Thank you so much, Timike. And Cecily Johnson is a master's in social work. She uses she, her, hers pronouns. And Cecily is a Georgia native and currently serves as the Director of Strategic Initiatives at Domestic Violence Network in Indianapolis, Indiana. She received her BA in psychology with a minor in women and gender studies from Mercer University in Macon, Georgia. She subsequently received her Master of Social Work degree from Georgia State University in Atlanta, Georgia, where she focused on community partnerships and capacity building. After spending most of her life in Georgia, Cecily relocated to Las Vegas, where she worked for the statewide Coalition to End Domestic and Sexual Violence, where she managed a federal grant project on elder abuse prevention through Nevada's Office of the Attorney General and U.S. Office of Violence Against Women. Currently, she focuses on community-wide plan. Diversity, equity, and inclusion stay at the forefront of Cecily's mind, and her goal is to do her part as an agent of change. Thank you so much, Cecily and Timike, and I'm handing it over to you.
Well, thank you, Colleen. And first of all, I want to thank you all for spending time with us today. We're excited to share with you what we're doing in Indiana. Before we get started, we just want to take time to acknowledge that there are people suffering and hurting all across the United States, and many of you are here today or love someone who's experiencing pain and hurt and loss through the wildfires and hurricanes and division, COVID, all related. The mirage of problems that COVID has caused and will continue for a little bit longer, hopefully just a little bit longer. And those who are really hurting from the racial tension and the civil rights and human rights loss of people of color by the hands of state-sanctioned violence. And we're just going to take some time to acknowledge you and welcome you to all to this space as we learn together. We're going to hand it over to my colleague, Cecily, or my friend to be. We're just getting to know each other, and she's super awesome. So I'd love to share her with you guys today.
Well, thank you. Already going to get me in my feelers. Thank you, Timike, and thank you, Colleen, for introducing both of us this workshop today. And welcome, everyone. Thank you so much for attending this session. I'm really excited about it. This is a passion of mine, and I can get into that as we go move forward in the program. But before we get started, again, my name is Cecily Johnson. I'm the Director of Strategic Initiatives at Domestic Violence Network. And for those who are unaware, I wanted to share a little bit about what my organization does. Domestic Violence Network, or DVN for short, is a nonprofit DV prevention agency located here in Indianapolis, Indiana. We serve Marion County, which is where Indianapolis is housed. That is the county for the city of Indianapolis. And we also serve the surrounding donut counties, is what we call it, because imagine it's a circle. And together that makes the central Indiana community. And the mission of DVN is to change the culture that leads to domestic violence through advocacy, education, and collaboration. We are not direct service providers. We are essentially the intermediary or the connector. So we work with medical, legal, fellow DV agencies, community partners who are allies in the DV movement, And we make sure that we connect all of those groups in order to provide best services for our survivors. We all want to make sure we all know that it's moving parts. There's so many of our agencies that have to come together to give our survivors the best care. So education, and why you all are here today, is a large component of our work. So we go out and speak to community partners, individual community organizations. We do events like this. We do presentations and education on DV in both the corporate and nonprofit sectors, public and private sectors. Essentially, if you invite us, we will come and do, we have a training program essentially on DV overall, but we have designed our trainings that they take into account specific scenarios. So when I mentioned that we work with medical, we speak with physicians, whether it's private care or we go into hospitals, and we explain, here's what DV is and isn't, and here's how it looks or could look in your world. Here's how it could look with one of your patients, maybe a nurse that you work with, maybe in your own life or with a fellow physician. So we explain DV in how it looks in their world. And we do that with many other types of institutions like legal. So speaking with law enforcement, with attorneys, judges, that is a big part of what we do. And then in addition to working with those sorts of entities, we also work with youth. We know that, and I'm sure this is no surprise to anyone here, that our perpetrators and survivors of violence are getting younger and younger. Unfortunately, the rates of teen dating violence, it's growing, that number. And so being a prevention agency, we truly believe if we can get in front of our youth as soon as possible, then maybe we're preventing a future perpetrator or survivor of domestic violence. Our goal, of course, is to stop the cycle completely. We make the joke that we want to work ourselves out of the job. So that is our role, essentially, in Central Indiana and for our community, to educate in hopes of preventing future DV incidents. I'm happy to share more about my organization, but in the interest of time, because I know we have a lot to get through, I'll pause here and transition to another component of what we do at DVN, which is our community-wide plan. And Timike, if you could advance the slide, please. And the community-wide plan, I will say, is my baby. You will hear me speak about it with a lot of passion. Our community-wide plan is, I think, why you all are here today. It is what I oversee and created with the help of my amazing colleagues at DVN and our community members. Our community-wide plan is our strategic plan, essentially, to address the needs of our Central Indiana community and address those needs as they relate to domestic violence. We just launched the 5th iteration of our community-wide plan, or CWP for short, and we named it Equity, as you see on your screens. And my hope is that as I explain equity and define it for you and explain our why and why we felt this was important and how this applies to centering the needs of survivors, particularly Black and African American women, I hope that you are able to kind of see our vision and where we're going, what we've done, and perhaps take some ideas back to your places of business, your organization, maybe community members, whatever that setup looks like. I'm hoping that this is helpful for you to bring back to your respective communities. So equity, as you see, our plan, and we use the bylines, listening to the truth, amplifying voices, and changing systems. We were extremely intentional with this plan. We wanted this to be an informed and intentional plan, not to say that our previous ones weren't, but as Timike mentioned when she first spoke about everything that's happening in the world around us, before COVID, before a lot of this has been brought to, I guess, the front lines, the limelight, we knew that equity or inequity was an issue. We knew that we were not seeing equitable services for all of our survivors. And I'm going to pause here. I just saw something pop up in the chat. Yes, this plan is on our website, and I will share the link to our website to this plan at the end of this piece. So thank you for asking that question, because I forgot to mention that. But it is on the website. So with equity, we spent a year and a half putting this together because, like I said, we wanted this to be intentional and informed. We wanted to amplify the voices, as you see, of those who have been historically left out of the conversation. The term that we often hear is you want to make room for another seat at the table. And we believe at DVN that we need to get rid of the table. That table was built not necessarily for everyone, it was not necessarily inclusive. We need to take that table away and build an entirely new one with with all the communities that we want to serve. We want it to be as inclusive as possible. And so we want to build that new table together with everyone there to make sure that we all are getting we're getting the services that we need in the way that we need them, because it looks differently for communities. I say this being in the DV movement, we acknowledge that in the domestic violence movement, Black and African American women in the LGBTQ plus community have historically been left out of the conversation in terms of resources and best practices. Some argue that it was intentional, some argue that it's not, but the point is that the nuances of these communities have not been taken into consideration historically, and we're seeing that today. And with this community-wide plan, we wanted to help close some of those gaps and eliminate some of those barriers that are unique to these communities, whether it's in prevention services, resources, safety planning. We wanted to do our part to help make sure, again, that we are including all communities as we were talking about domestic violence prevention. And, the DV movement is not alone. You think about the suffragist movement, you think about women's rights movement, equal pay, all guilty essentially of not specifically including these groups, Black and African American women and the LGBTQ plus community, which is why we wanted to make sure these two were our populations of focus in the plan, because we didn't want to make another effort without being specific, and again, without being intentional of the needs of these specific communities. Can you advance, Timike, please? So the why, you've heard me mention the populations that we are working with, and why these populations. Well, the research, again, this plan we've been planning this for a year and a half, but we all have been seeing, these are the trends, unfortunately, we've been seeing in the DV movement and other movements across the board, that Black and African American women are often excluded from social movements. As I mentioned, when you think of the suffragist movement, when you think of equal pay, women's rights, these groups were left out. The LGBTQ plus community are often excluded from programs and prevention efforts in terms of nonviolence for a myriad of reasons. These groups experience violence at higher rates than white cisgender heterosexual individuals, and yet these groups have the least access to services, and that's not okay. Next slide, please. And so here are some stats, facts, and figures that we like to share just to bring it home as to why this is such a big issue and why we chose to focus on these groups. So Black and African American women are 2.5 times more likely to experience DV than white women. And again, they are the least likely to seek services and often feel that services are not tailored to them and their specific needs. Due to the long legacy of dehumanizing treatment of Black women, they often experience violence with no legal recourse to counteract it. So that brings in our relationship with law enforcement and the criminal justice system. Studies show that Black girls are perceived as more independent, more knowledgeable about sex, and in less need of protection from white girls. So therefore, that is essentially this act can't happen to them because they are not in need of it. They're independent, they know better. They can't possibly be a survivor or a victim of violence because of these stereotypes and assumptions that you see on your screen here. And we know that at least 56% of Black, trans, and non-binary individuals experience DV. But again, there are no services, or there are few services that take into account the specific needs and the nuances of a relationship, of a violent relationship, when we're speaking about Black, trans, and non-binary individuals. And I want to take a moment here. You'll hear me differentiate between Black and African American women, and I did that on purpose, and our plan is written that way on purpose. Because there is a distinction, and I want to define really quickly when I say African American, how we define African American they're descendants of enslaved Africans who were brought to this country in the 60s, what we think 1619 is the first slave ship that came to America. They were captured from their native homes in Africa, in different countries in Africa, and then brought to the US by the slave trade Middle Passage. So that's when we say African American. When we say Black, we mean individuals of African ancestry native to countries within the continent of Africa. We're looking at the African diaspora. So we're not just talking about natives of different countries in Africa, but also Cameroon, Haiti, Jamaica, Bahamas. That's when we say Black. It's a more all-encompassing term. You will hear me use both, Black being the all-encompassing and African American specific to descendants of enslaved Africans. I know that was a lot I just threw at you, but I'm happy to explain that further. We can chat offline, send me a message in a private chat, or I'll give you my email address after this, and you're welcome to email me to talk more about it. But that is why we have both terms. Just wanted to clarify. Next slide, please. For LGBTQ plus, we know that 70% of LGBTQ plus youth have been bullied at school because of their sexual orientation. 2 out of 5 men identifying as gay or bisexual will experience intimate partner violence in their lifetime. 50% of lesbian women will experience DV in their lifetime. In this community, 2.6 times more likely a person of color who is trans is to become a victim of DV than a non-LGBTQ plus person, which what I mentioned with Black and African American women. And as you see these terrifying figures and statistics, there are few resources to address this, hence equity, why we wanted to do our part, at least starting here in Central Indiana, and hopefully build a movement. I am an ever optimist. So this is our why, this is our focus, and this is what the research told us to guide us to do this plan. Next, Timike. So the process of how we got here, the why. So once we did our research, where are the gaps? And I just shared those facts and figures with you about the gaps across the board nationally, but then we looked at home. What are we seeing here in Central Indiana? We did a community-wide e-survey. So we sent out a SurveyMonkey with a question. It said, and I have a picture of it coming up, but we wanted to ask our community members, we wanted it to be a true community-wide plan, not a DVN plan, a community-wide plan. And we wanted our community members to tell us what is it that they felt that they needed to know more about, or maybe groups, populations that they wanted to know more about to help them do their work better. And we got those responses. And after we got the e-survey back, we did focus groups. So we gathered our service providers together into mini focus groups. I think we did between 8 and 15, and we did several of them where our community providers and just community members took this survey, came in and just had a conversation, and DVN staff sat back. We just presented a few questions for them to answer because we didn't want to guide anyone's, we didn't want to influence anyone. We wanted to hear from their mouths, why did you choose this group, or why did you say that this was of interest to you? And what is it that you're seeing or not seeing in our community that prompted you to want to answer this way? And it was a very honest conversation. It was wonderful. And this also helped to guide our work. Highly recommend focus groups. And then we took that information back to our research analyst who ran the numbers and who said, this is what the ranking looks like. This is what was said. This is what was captured in this meeting. And this is how this will help kind of build the blueprint for our plan. Next. So here are survey results. So the question, please rank the following topics in order of preference using a scale of 1, topic of most interest, to 9, topic of least interest, to determine what you're most interested in. And you can see all of the different subjects that some of this was internal. So we had so many different topics that we felt we could speak about, and then we narrowed it down, looked at what we were seeing in the news more often, what we know about our community. I brought in information that I'd seen living in Georgia and in Nevada. And as you can see, it was an inverse ranking score. As you can see, the most popular options were women of color and LGBTQ plus community. And then with those focus groups, it went from women of color to Black and African American women specifically. So that also helped guide us. Next. After the survey results and the focus groups, we did a community forum, which were even more narrowed focus groups. Once we got those populations together, we wanted to know, okay, why these populations specifically. So it was an in-depth discussion between DVN community members, partners, and survivors. We provided a series of questions for these participants, and it expounded on the initial e-survey, and the responses were recorded, and all responses were anonymous. And I should make that clear, that we made sure that everything said, because it was a safe space, that we kept organizations, individuals, we kept it private. We knew who attended the event, but we did not record who said what, to respect the integrity of the process. Next. Simplex was our last step. So Simplex is a focus group, but much more formal, and I can provide more of that information and how to get one, and how to facilitate a Simplex. I myself am certified, and then have wonderful folks who've been doing this for much longer than I have that could facilitate Simplex sessions. So I'm happy to provide that information. But it's a problem-solving tool where, through group listening sessions and facilitation, a team will develop a creative solution together that is informed by content experts and key stakeholders. So we had a Simplex session 1. It was for specifically the LGBTQ plus community. And when I say that, in this Simplex, because again, earlier I said that, we wanted this to be intentional and informed, we created a space where folks who were a part of that community could come together to tell us at DVN what it is that they have seen, not seen, what has been done right, what hasn't been done right in the DV movement as it relates to this community. We did the same thing with Black and African American women. The group who participated, it was only Black and African American women that told DVN, this is what we're seeing, what we're not seeing. Both of these groups are very honest with, this is the DV movement, and you missed the mark here. And they would tell stories about themselves, or maybe a relative or a client that they had, someone that they had come to their organization, or maybe just a close relationship person that they had. And they said, I couldn't get this resource, or I went to this place and I felt like I was the last thing that they wanted to do on their to-do list. I felt like an item to be checked off. I didn't feel like anyone was really supporting me. And it was honest. Some of the incidences happened outside of Indianapolis, nowhere in our service areas. Some, it was local. And hearing that, you're like, oh, that's not okay. But it was good to hear, because we know it helped us learn where the work needed to be done and what we needed to do better, and how we needed to communicate with our partners and community members on what we needed to do collectively to do better for our for these communities and for our survivors who are a part of these communities. We also wanted these Simplex sessions to be, again, made up of the groups that we are serving, because what I did not want was for a person who was not a part of the LGBTQ plus community to come in and say, this is what you need and this is how to do it. No, I didn't want someone who was not a Black or African American woman to come in and say, this is the issue, this is how you should fix it, and here's why, and give their 2 cents on it when you're not a part of that community. I am all about collaboration and ideas and bringing in those ideas. But at this stage, it was, you tell me as a part of this community what you need, not what I think you need. What is it that you need specifically? And that was very important to me and to my colleagues at DVN. It was that type of space. And I believe that having that type of space is what made for a great conversation, and what helped us to form a plan that was community informed and informed by these specific communities, so that we weren't in there, so that we didn't come up with a plan that sounded great in theory, but really wasn't applicable to communities, because that's been done way too many times, way too often. So we wanted to make sure that this was intentional to these groups and made sense for these groups. Next. So after the, wow, these numbers are all weird. So I apologize for the numerical issues. I don't know what went on. So what DVN will do after our simplex session, we left that session with great conversation. In both of them, there were tears and joy. We all left happy and, friends, but there were some moments of vulnerability and moments of anger, to be quite frank. And it was great. It was what we needed to hear. It is what our participants needed to say out loud and do for themselves. Um, we people weren't necessarily upset at DVN. They weren't necessarily upset at their organizations that they attended or that they visited for resources, but it was a moment for them to say, this is what went wrong here. This is the experience I had here, and we were just kind of the sounding board that these participants could use. And it was again great because it helped us know how to best help. And so for the Black and African American women, when we left that simplex session, we left with action items and action steps, and this is what helped form our plan. So a task force to develop a project plan to ensure better representation and specific events in the Black community or for the Black community. So we have convened a coalition of sorts of Black and African American women, and in this, it's as if we're doing simplex, that process I talked about, part two. We're building the plan, I call it. We're making action items and creating steps and objectives that we want to achieve for our community. At this point, we've discussed networking events for our professionals. We've discussed having education and training, which you see on your screen now, how to create those educational and training brochures geared toward assisting the Black and African American community. It was brought to my attention on many occasions that when they see resources, it's usually not a person of color or a woman of color. It's usually tends to be white women or white men, white women, no color historically. But in this task force, we want to change that. We want to see us represented to know that this happens to everybody. We know the statistics. This isn't something that is unique to one group. Anyone can be a victim or survivor of domestic violence. And we want to see on this brochure, like, oh, I can get help here because this person looks like me. It's representation. Representation absolutely matters. So in this task force, it's going through really creating steps and creating objectives. And those, I think the education and training component has been the most common theme through every meeting of how do we create a curriculum really to educate certain communities and certain entities, organizations who would do well to know how to best serve Black and African American women who are survivors of DV. Additionally, so an event to host Ujima, if you're not familiar with Ujima, they're an amazing resource. Their work is entirely on domestic violence, the intersectionality of domestic violence and Black African American women. They're phenomenal. They are my gurus, really. I follow them and I go to them for technical assistance. And so we will have them throughout the year to facilitate events virtually at this point, but facilitate things like this where they present findings and share their information with us to help give us tools to better our Central Indiana community. They go across the country for these trainings, or did, so still virtual, and provide this kind of technical assistance. And this is who we have been working with closely. And so having them as our TA provider has been wonderful because it's helping us do the work, our best work for our community. We want to expand programming to include specific issues related to the Black and African American community on healthy relationships, and education outreach to service providers on trauma-informed care. Some of this educational outreach is in the community, but also specific places. So earlier I mentioned specific organizations we want to address. We want to speak to churches. Which is a lot where many Black folks, at least in my experience, it's kind of our haven. That is where we tend to be central, is in the church. So we want to get into churches. Any Black-led, Black-focused organizations, that's who we want to partner with and work with to make sure that we are getting in front of as many folks as possible to say, you are not alone in this. This is not a this is not a specific person thing. Like Black and African American women absolutely have been and are survivors, and here's how it looks differently for us. Um, so that has been a lot of the conversation in the task force coalition, and I'm really excited about it. We're getting a lot of great movement, and I'm happy, again, interest of time, I'll keep it moving, but I'm happy to share more about what that task force looks like and does. Just reach out to me offline. And Tamika, next. And then for the LGBTQ plus community, again, this is informed by the community from the Simplex sessions. This is another task force that I actually don't lead. I oversee it, but one of my colleagues is leading it, because with both of these task forces, again, remember I said we wanted to make sure that it was folks of these communities leading these task forces and these efforts. So my colleague is actually the lead with the task force, and I'm happy to put you in contact with them. But very similar to what is happening in the other task force, it's what is it that we need to do to get in our community to share this information? What is it that we need to do to say that we should be included in this movement? And what is it? What are the resources? Who do we need to speak to? Who do we need to get in front of? Again, outlining those areas. So we need to get in front of youth. This group needs to also get in churches. This group also needs to get in front of the community centers that are in our Central Indiana community. How do we come together and have this collective effort, again, to make sure that all survivors are included in our prevention efforts and in our resources and in the coalition? I feel like we're mirroring each other. When the lead, my colleague who runs this task force, and I speak and do our follow-ups, it really is mirror image. We're both still building the plane in our respective coalitions. Education and training has been a big component in this group as well. There are a lot of misconceptions about domestic violence in this community, and we want to dispel those myths and put to bed any of those just negative perceptions on what DV looks like in this relationship. We've learned so many different stereotypes and assumptions that are terrifying. And so we want to make sure that we are giving appropriate and accurate information, and that this coalition, this task force is helping to do. How do we get in front of folks to give the real story is how it's presented. Collaborate. We have an organization here called Queering Indie, and one of the big pieces of this, one of the big objectives is to create a rainbow book. So a book that is filled with resources that specifically serve our LGBTQ plus community. So if we need housing, if we need a physician for something specific, this something that I learned from this community during this Simplex, when we were in that session, they were like, there are plenty of resources on paper to go to, but it's usually that one person who works in a place, who knows a guy, is how it's done, and it shouldn't be that way. How do we make this network and this collective collaborative effort? And the term is Rainbow Book that was created. And so it's really just, it'll be virtual and a paper book of like a hard copy of resources that are available for the LGBTQ plus community, again, ranging from housing, is it medically related? Is it legal? Is it legal related, legal assistance? What are the resources that are needed that have been inaccessible for so long, especially in our Central Indiana community? And then a film screening of a movie, Blindsided, that deals with domestic violence in the LGBTQ community, LGBTQ plus community, and in a relationship. I've seen it. It's eye-opening. I think it's a great conversation starter. I believe you have to have a link to access it. I don't have it anymore. My colleague does, who's helping put together this film screening. So if you're interested, again, please email me. I'm happy to share that. But we're going to host a film screening and a panel discussion, because the movie opens up a great dialogue about what does domestic violence really look like in this community. And this is what you saw in the film. Let's talk about it in real life and action steps that we can take if we were this person's family member or colleague, or whatever that relationship is. How can we step in and help? We want this to be practical application, because that's the way we're going to make change. And so this is my information. For any questions, please feel free to email me any questions about the community-wide plan. I've put our hashtags that we use on social media. That's our Instagram, if you'd like to follow us to see what we're doing. But there's my email. Please feel free to let me know if I can help with anything. I kind of grazed the surface with what our community-wide plan is doing, but I'm happy to share any insight that you have, or if you have any ideas. Maybe I was thinking of doing something similar to the task force or the brochures or whatnot. I'm happy to discuss that with you as well. So thank you for your time. Thank you, Timike.
Thank you, Cecily. We're going to be available hopefully for overall questions, but if you have any questions specifically to the details of this plan, please email her. I'm going to talk to you really quickly about what we've done at the coalition. First of all, my role is primary prevention. We're blessed enough to have a whole team that looks at the social determinants before any violence ever starts. And so when we looked at, for example, our recentering report that Colleen talked about, how we created our strategies after we heard from survivors, we realized that we weren't hearing from people prior to, we hadn't heard the voice, and we really hadn't heard the voices of Black women. Let me tell you why this is important. We know that Black women experience 45.1% of Black women experience some type of interpersonal violence in their lives. And then we looked in Indiana, and we looked at statistics like Black women and girls between the age of 18 and 85 only make up less than 4% of the whole state's population. But 2018 statistics, 33% of all new chlamydia cases were Black women within the sexual reproductive age. 44% of the gonorrhea cases, 58% of all HIV cases, 51% of all newly diagnosed AIDS cases. We looked at our infant mortality and maternal mortality. The Black infant mortality, maternal mortality is a crisis throughout the country. But we saw in Indiana, our mortality rates were 53 of all 100,000 live births of Black women, live birth, were experiencing maternal mortality, and 21% of all live births babies were, I think I got those statistics all wrong. However, they were tragic. And we noticed that Black women disproportionately live in poverty, and we know that violence is more prevalent in communities of poverty. So we asked ourselves, why are Black women having these adverse outcomes? What are the underlying conditions that cause these adverse outcomes? And since we do our primary prevention work using the public health approach, we have to first define the problem. So we've decided as an agency that how we define the problem is listening to people who experience the problems. So we decided that in order to be effective at a strategy to address the social conditions affecting Black women and girls in Indiana, we have to ask them what they need. And so we decided we are embarking on a program to look at the data through focus groups. We want to gather statewide focus groups where we ask Black women and girls specifically what do their communities need to flourish? We ask, what do they need to feel safe, stable, and nurturing? What do they need to be supported in order to keep safety in their communities? And so this project it's been modified due to COVID, but we're working at seeing how we can gather these thoughts and information from Black women to say, what are your barriers to healthy reproductive and sexual health? Because we know that that is a protective factor for sexual and interpersonal violence. we decided that we wouldn't create strategies without using our E4 framework. Everything we do, we look and see if it's equitable, efficient, safe, and ethical. But we want to start any strategy is asking, is it equitable? So before we retrofit strategies and try to make it fit populations who that have been marginalized, we want to develop it around the needs and the voices of those who have experienced the harm. So we this is why we chose to listen to Black women and girls in Indiana with in mind creating this environment where they have the ability to thrive as an equitable environment. Kind of rushing through that. But so what do we want to do with this information? When we hear from Black women and girls, we have a plan to create action because we don't want to listen and do nothing. That is a waste of everyone's time and it breaks trust. So what will we do after this? After we listen, after we collect the data, after we figure out where the needs are, we're going to decide where we invest our resource. We're gonna realize that where we put our money is where we put our priorities. And so we're gonna take the time to say and where our resource would go. How do we strategize as an agency? That's very important as well. We create strategies that are heard from people who have experienced the harm. So how do we develop strategy is going to be a primary thing we're going to do with it. And most importantly, I think, and that is often is empower the Black women and girls who speak with us by advocating for public policy change. We want to be at the table and to look at these policies in a place of equity, not only always going back to to address disparities, but how do we develop equity from the beginning of strategies and public policy and where we place our investment. So that was a really quick way because I leave time for questions, but I'm almost done. And so that is what we want to do, and this is why we want to do it. So actually, Cecily and I had a conversation because we were listening, Black women and girls, we must be doing the same thing. We both are in Marion County, even though I'm a state coalition, that's where we are, and we realized there's so much to be learned. Her questions that she asked from her focus groups are completely different than mine. So we need to be, it's the intersectionality we talked about earlier. The Black women and girls and the questions that she's asking won't get the questions that I need answered in order to create primary prevention strategies in a state level. So it's important to, for this project, to partner with multi-sectorial partnerships. I do a lot with health equity in itself because those same determinants that create a healthy health equity also create equity when it comes to the social conditions that we're looking for reproductive health. So two things. We have questions for you guys. Please put them in the chat. And we want you to put in the chat a question we have from you. If you don't have questions for us, what is your biggest takeaway from our session today? What about what we've said resonates with you or with your agency's strategies that you may pursue in the future? So the chat box is open for that conversation and for questions. If you want, I'm gonna put my email, and Cecily, we can put our email in the chat box. And so if someone asks for additional information to be shared after this town hall, you can feel free to reach out to me about our agency. I also have resources in this last slide from our coalition. We our strategies, the way we look at things and how we do our work, we have several different ways to kind of give that, and it's free. We have these toy boxes. It's going to be the bottom left hand link. These are games that we look at in activities that we learn to develop our primary prevention strategies, and they're free to you all. We also have our recentering report, which is the report that Colleen talked about in the panel that I don't think that's free to mail, but we have it online, and it tells you how we looked at the data that was provided to us and how we changed our complete strategies to address the needs per the voices of survivors. And we just have our storybook that talks about how we see primary prevention and the walk that we've taken on primary prevention, and also how we listen to populations of the marginalized. With our sidewalks is a really good example how we listen to people with disabilities, and we create strategies to change outcomes for people with disabilities based on how we listened and collaborated with them. So listening is the strategy that we need, that we prioritize, and these are just different ways that we've done it. Okay, I'm trying to get to a question, but it's going so fast.
Well, can I just make a comment that I love so far? The theme of the takeaways is that folks are seeing that community should drive the work, that the groups in the communities that folks want to serve are the ones who should be coming up with these strategies or helping to develop these strategies. And intentionality, intersectionality, the factual realization that DV disproportionately affects these communities. I think all of these are wonderful answers. And I love that these are the takeaways, because this is exactly why we're here. It is community driven. It is about getting with these communities and having them tell us what it is that they specifically need. And that's exactly what Timike and I are doing, what we want to do, and it's our passion. So I'm really excited to see all of these takeaways and responses.
Shelby had a question, and she asked, how are we securing funding for the incredible work we do? And that is a multifaceted question. First, I receive my money through rape prevention education money through the CDC, and it's 100% primary prevention work. So that is helpful to do the work that I want to do before violence ever starts, which is often difficult to do. But we like I said, put your money where your mouth is. We create line items for equity in every single grant we write, making sure that people who don't have the resource can get paid for their time, making sure that our space is equitable and accessible, making sure that transportation is available. It is a priority for every single grant we do, and it allows us to have money there proactively, not looking at equity on the back end, but before we create any grant and strategy, how can we create this opportunity for any person, no matter what their mobility level is, their vision, their hearing, how can we create a space where everyone is welcome? And so that is a very big priority that we do. For our money comes from anywhere that we can get it and everywhere that we can get it.
Thank you so much. I'm afraid we're going to get sucked out of session. And so I just want to thank you, Cecily and Timike, so much for your amazing, exciting work and your generosity in offering your email for follow-up if people want follow-up technical assistance and resources. But thank you so much for helping to guide us with your work. It was inspiring. Thank you.
Thank you for having us.
Thank you. I'm sorry. That was really fast. My email is in the chat. Please reach out to me with any questions, and I'll be happy to answer. We also have on our website some institutes that we've done, some trainings that we've done outside of here. So I can give you a host of resources just to understand more how we do. I knew this was happening. Thank you, Colleen. So thank you again, everybody.